There, suka ng suka ba ang baby mo o yung bata? Well, worried ka ba baka ma-dehydrate na? What are the signs to look out for? Kailan mo dadalhin sa ER ang bata? Well, in today's Ask Me Anything episode, we will talk about vomiting in kids. Before anything else, I'm Dr. Kristine Alba Kiat. I'm a board certified pediatrician, and my mission is to empower you moms and dads so you can raise happy and healthy kids. In today's Ask Me Anything episode, we will talk about your top 10 most common questions on vomiting. So let's get started. First question, what causes vomiting in children? Well, madaming possible causes ng vomiting. First up, it can be from a viral infection like a stomach flu or acute gastroenteritis. It is the most common cause of vomiting in kids. Other causes can be food related. Nagkaroon ba ng food poisoning or overeating or an allergic reaction to the food? These are causes of vomiting as well. Other thing, it can be motion sickness. So, nag-travel na nagka-motion sickness ang bata, pwedeng mag-vomit. Other conditions like migraine, severe headache and vomiting, or head injuries can also lead to vomiting, or appendicitis if there's a severe abdominal pain and vomiting. Okay, number 2 question. When should I be concerned about my child's vomiting? So it is important that you seek medical help, bring your child to the ER, or have your child seen by a pediatrician if your child is already showing signs of dehydration. Ano ba ito? Your child has dry mouth, dry lips. Important is decrease urine output or konti lang ang wiwi. There are no tears when crying. Also, aside from dehydration, seek medical attention if continuous and persistent na yung vomiting, dire-diretso na for more than 24 hours. You should also worry if nag-vomit na yung bata ng greenish or yellowish color that may signify bile. And if vomiting is accompanied by sakit ng tiyan or abdominal pain, mataas na lagnat or high fever, and lethargy or weak na yung bata. Okay, number 3 question. What are the signs of dehydration in a vomiting child? We talked about this earlier, but signs that you should worry that your child already has dehydration. If the child has dry mouth and cracked lips, if your child has a soft spot, yung bunbunan na sunken na, so a sign of dehydration na yon, makikita mo yun sa head ni baby. If there is reduced urination or decreased urine output, your child should have a wet diaper at least every 6 hours na puno. Or if you notice hindi na masyadong wet yung diaper, or if older child, less frequent visits sa CR or sa bathroom. And also, signs of dehydration include extreme thirst or weak looking na rin yung bata. Okay, number 4 question. How can I treat vomiting at home? An important question because there are stuff that you can do at home to help your child. So it is important first to rest your child's stomach. You avoid foods for a few hours until nag-stop na yung vomiting. So let your child's tummy rest for a bit. And also, to prevent dehydration, offer sips of fluids. And a good choice of fluid is an oral rehydration solution. And you can also gradually introduce solid bland foods para hindi ma-upset yung stomach. Alright, number 5 question. Can I give my child medications to stop vomiting? Well, you have to be careful. Over-the-counter medications that stop vomiting are generally not recommended for kids unless, of course, it is prescribed to the doctor. So, it's important na evaluate muna yung bata ng pediatrician. Number 6. What foods or drinks should I avoid when my child is vomiting? So, what not to give for a vomiting child? So, you should avoid sugary drinks kagaya ng soda, soft drinks, or juices because sugary drinks can worsen dehydration. You can also avoid dairy products because it might further upset the stomach. Also avoid greasy food for the same reason para hindi ma-upset yung stomach and irritate yung stomach lining. And avoid solid foods kung active yung vomiting phase ng bata. Okay, number 7. What causes green or yellow vomit? Is it serious? Yes. Greenish yellowish vomitus can signify bile. If may bile na sa suka, this might indicate that there is blockage in the intestine, which is a serious condition. If you notice this happening, bring your child immediately to the emergency room. Okay, number 8. How can I prevent vomiting during travel or what we call motion sickness? So, encourage your child to what? To forward facing dapat look at the horizon and dapat may fresh air or ventilation inside the vehicle. Tapos, not too heavy foods during travel, please. Just give some snacks, some bland foods and crackers. And you can ask your pediatrician if your doctor can prescribe a medication for motion sickness because doctors need to check if this is age depends on the appropriateness of the child's age. Okay, number 9. Is vomiting always a sign of illness? Not necessarily. Vomiting can be from overeating, can also be from stress, or extreme physical exertion na pagod ang bata, so sumuka. But if severe, persistent, continuous vomiting, this should warrant a medical checkup. Okay, number 10. When can my child return to school after vomiting? Okay, an important question. Pwede nang bumalik sa school if wala nang vomiting, no more vomiting for at least 24 hours. Your child can eat and can keep the food down already. If your child can also drink normally and keep the liquids down. If your child does not have any fever or does not have any contagious symptoms like wala ring diarrhea. Okay, if you have any other questions, how about you type in the comments section below and I'll get back to you. If you like this video, watch my next video where I teach you about other child health problems.